Macular degeneration is the leading cause of blindness in the United States, slowly stealing central vision. Dr. Edward Kim discusses the forms of this disease and the treatments available.
Well, generally, macular degeneration presents with a little bit of distortion or a little bit of a blind spot right in the center part of the vision. So patients will notice that they can't read quite as well, they're missing letters, or they're looking at television and the picture looks distorted, and that's when we know that macular degeneration is there. Macular degeneration is the process of aging that occurs inside the eye. If I may, I'd like to show you a model of the eye. Here we have a model which is cut in half, and you can see this is the front part of the eye. The back of the eye here, all of this orange layer is called the retina. The very center part of that retina is called the macula. It's about the size of a pencil eraser. It's pretty small. That has to do with our central vision. When you look right at me, you're using your macula to see me, but you're looking at the peripheral part of your vision with the rest of your retina. So it has to do with the central part of the retina, and that undergoes some aging changes. We diagnose macular degeneration by looking in the back part of the eye with a special instrument called an indirect ophthalmoscope. We're able to see the entire retina that way, but in particular the macula. The macula generally has a very nice, even orange color, but when macular degeneration is present, the color becomes mottled. There are further tests that we can do. For instance, a fluorescein angiogram is frequently used, which is a dye test with taking pictures of that area, and we can see if there's any abnormalities of the retina that way. Age is a risk factor. It would be generally an older patient. That patient may be white patient. White Americans have much more incidence of macular degeneration than other races of color. Cigarette smoking is a very high risk factor as well. And those people who have smoked for a long, long period of time have a much higher chance of developing macular degeneration. There are some factors that we can consider for prevention. Ultraviolet rays seem to be a factor in generating some of the damage that we see. So if you wear good ultraviolet sunglasses, that might help. Not smoking, big factor. And also taking now antioxidant pills such as vitamin C, vitamin E, zinc, beta-carotene. That's been proven to slow down the progress of macular degeneration. The other thing that has recently come up is that those patients who are taking medications for their cholesterol, to lower their cholesterol, those are called statins, they have found that that can reduce the incidence of macular degeneration by 50%. The treatment that we have right now today are only to slow the progression down. We don't have anything to reverse the effects of macular degeneration to give back natural vision. But laser treatment in various forms are quite effective for the proper candidates. Now, we do have two different types of macular degeneration. We have the wet type and the dry type. The treatment is really for the wet type. Let me explain that the wet type is the one that has lots of abnormal vessel growth. The vessels leak fluid or bleed, and hence the name, the wet type. The dry type is the more common type of macular degeneration. It has no vascular problems, and it has a better visual prognosis, but there's no treatment available for that at this time. We expect a lot of new developments coming up in macular degeneration research. Currently, there are multiple trials of medications that are placed within the eye to halt and reverse the effects of wet macular degeneration. The preliminary results look very exciting, and these are medications that are placed either once a month or even once every 6 or 12 months into the eye. And most of these medications actually reverse the growth of the vessels. They are called anti-vascular growth factors. The earlier we can get to macular degeneration, the better chance of slowing the progress of macular degeneration. If we can stop it or slow the progress, that patient has a much better outlook 5, 10 years down the line.